Today we are diving into an important health topic, how to test for fatty liver disease, also known as NAFLD. With the rise in obesity and type 2 diabetes, understanding how to diagnose this condition is more crucial than ever. Let's explore the latest research and guidelines on this topic. First, what is fatty liver disease? NAFLD stands for non-alcoholic fatty liver disease. It is a condition where excess fat builds up in the liver, not due to alcohol consumption. If left untreated, it can progress to a more severe form called non-alcoholic steatohepatitis (NASH), leading to liver fibrosis, cirrhosis, or even liver cancer. So how do we test for fatty liver? Let's break it down step by step. Step 1. Initial screening. According to the European Association for the Study of the Liver, the initial screening for NAFLD often starts with a simple ultrasound. It is a non-invasive and can detect hepatic steatosis or fat accumulation in the liver. Step 2. Blood tests. To evaluate liver fibrosis, healthcare providers commonly use the FibroScan index, which relies on platelet counts and liver enzyme levels. This is recommended by both the American Association for the Study of Liver Diseases and the American Diabetes Association. Step 3. Advanced imaging techniques. If initial tests indicate a potential problem, doctors might use advanced imaging methods like transient elastography, also known as FibroScan or magnetic resonance imaging. These tests measure liver stiffness and fat content more precisely without needing a biopsy. Step 4. Enhanced liver fibrosis test. For further evaluation, the ELF test measures specific biomarkers in the blood to assess the extent of liver fibrosis. This test is particularly useful for patients showing higher risk. Step 5. Emerging biomarker panels. New blood-based tests like PRO-C3 and NIS4 are under development. These panels improve the accuracy of diagnosing NAFLD and its progression to NASH, offering a promising tool for future testing. Step 6. Clinical trials and research. Ongoing research by institutions like the National Institute of Diabetes and Digestive and Kidney Diseases is crucial. These trials help us understand the genetic factors and progression of NAFLD and test new treatments. Step 7. Management and lifestyle interventions. Weight loss through diet and exercise is key to managing NAFLD. Additionally, treatments like glucagon-like peptide-1 agonists and bariatric surgery can improve liver health. Comprehensive guidelines from various medical associations emphasize the importance of lifestyle changes alongside medical treatments. In summary, testing for fatty liver disease involves a combination of ultrasound screening, blood tests, advanced imaging, and sometimes more specialized tests. With ongoing research and new diagnostic tools, we are improve our ability to detect and manage this condition early. Remember, maintaining a healthy lifestyle is your best defense against NAFLD. Thank you.